There is a purpose for the foreskin, that's why it's there. I recommend circumcision for boys who've had problems with the foreskin itself. Apart from that, a lot of boys will have tight foreskin, which is a normal spectrum. And most boys with tight foreskin will eventually grow out of it, bar 1% once they've gone through puberty. So that 1% is the group that I need to identify and offer circumcision, because without a circumcision and a tight foreskin, they will have trouble in later life with erection and sexual function.
Understand. So generally you're of the view that the vast majority of boys, with the exception of course for religious purposes, etc., the vast majority of boys actually don't require circumcision.
That's right, yes.
Okay.
If the foreskin is normal, my basic analogy is if it's not broken, I don't fix it. So most of them are not broken. Most of them have got nice, normal, supple foreskin, which doesn't need anything to be done for. The circumcision, as I mentioned, if it's pathological, which means that there's something wrong with the foreskin, only then would a medically indicated circumcision be required. Apart from that, there's very few reasons to circumcise other than for religious or ritual reasons.
Okay, but so as a parent with a young boy, what are some of the telltale signs that might indicate there is something wrong with the foreskin? What should a parent look out for?
One of the things you need to see is if the child has had recurrent infection at the foreskin. Sometimes the recurrent infection will cause scarring. If there's trauma or bleeding, or there's pus coming out from the foreskin, those are signs that there's some sort of irritation to the foreskin, which may end up having scarring. Not all infection or inflammation will cause scarring. Only once there is scarring following infection, or if the child has had issues passing urine and the urine stream is poor, they dribble, they have a constant need to go to the toilet, every few minutes they have to run to the toilet, then those are indications that there is a problem with the passage of urine outside. So coming from the bladder out through the penis into the environment. So any problems with the passage of urine is an indication for them to seek advice or seek help from a surgeon to see if there's any need for any intervention. Most of the boys with scarred foreskin will require circumcision. Most of the boys with inflammation, infection of the foreskin will not require circumcision unless there's scarring. So in terms of problems with the foreskin, one of which is something called balanitis xerotica obliterans, which basically is long-term for chronic inflammation of the foreskin. And the cause of that is unknown, but the foreskin becomes progressively thickened and scarred, and the opening to the foreskin becomes very narrow. And these boys will have more and more problems passing urine. And for that reason, they will require circumcision, and that foreskin that's been taken off will be sent for histology, where the lab will analyze whether it's got the child has got BXO. If that's the case, then further treatment with steroids will be required for the rest of the head of the penis to prevent further progression of this disease. The other condition where we need to do circumcision for, if there's any trauma where the foreskin is tight and has come over the head of the penis and has caused problems with it. There's a condition called paraphimosis.
Understand. And is there like a minimum age at which circumcision can be done, or can it be done with a little newborn baby? Does the boy have to be of a certain age? Is there a point when it becomes too late to be done? What is your view on that?
So in terms of, we'll take aside the religious and cultural reasons for circumcision. The younger boys do not have problems with the foreskin usually. And so they won't have experience infection, they won't have experience inflammation. The inflammation happens later on in life, and once there is a problem...
Sorry, at what age though? What do you mean?
They can happen at any age.
Okay.
Infection, so you need to have an abnormal foreskin, before medically indicated circumcision is required.
Right.
So abnormal foreskin means that it's no longer soft. If you hold the foreskin between your fingers, it should be soft and it should glide on each other like a soft silk glove.
Right.
If it doesn't do that, if it's thickened, if it's hardened, it's knobbly, then the foreskin is abnormal.
Okay.
That's a medically indicated circumcision. But that's when medically indicated circumcision is required.
So age is not too much of an issue?
No, it's not.
Right.
And one of the other contraindication for circumcision is if the child has a abnormal foreskin or abnormal penis, as in a hypospadic penis. So if the child with a hypospadias, they shouldn't be circumcised at all until the surgeon repairs the penis. So,
can you briefly tell us what hypospadias is?
So a hypospadias is a birth anomaly where the penis doesn't form properly. So instead of having a normal straight penis with a hole at the tip of the penis is often bent and the hole is somewhere below the level of the head of the penis. And thirdly, the foreskin is not complete. Only the head, the top part of the head, the foreskin is there. The rest of the foreskin is absent in the underside of the penis. So there are three parts of a hypospadic penis: hooded foreskin, the abnormally placed opening, and a bend to the penis.
Okay.
So if the child has that, the surgeon will require the foreskin to use as a graft to reconstruct the penis.
Right, so it's best not to do any circumcision prior to resolving the hypospadias.
That's right, yeah. And usually once the hypospadias repair is done, the child will have a circumcised looking penis at the end.
Understand. So your advice to any parent with a boy is, correct me if I'm wrong, but if there is no problem with the foreskin and there is no religious reason, for example, it's probably best not to do circumcision.
That's right, yes.
Right.
If it's no problem, then leave it alone.
Okay. And all this, this view that it's more hygienic and so on and so forth, does that hold any weight?
Yes, usually if you can retract the foreskin, you can wash underneath.
Right.
If you can't retract the foreskin, then they may have chances of getting infection. Yes, there is a issue with it, but 99% of boys will eventually be able to retract the foreskin so that they can retract the foreskin and wash underneath.
Right.
The foreskin is also there to protect the head of the penis, to keep it moist, to keep it sensitive.
Right.
If you lose the foreskin, then the head becomes thicker, less sensitive, and less moist.
Right.
So there is a purpose in terms of for later use in terms of sexual function.
Yeah.
There is a definite association of having foreskin with sexual function.
Understand. So Doc, if circumcision is required for medical purposes, what's the procedure like? What's the treatment like? I mean, in brief, it's obviously a surgical procedure.
Yes, so I tend to do all my circumcisions under general anesthetic. That's because any form of local anesthetic is painful, and I don't wish to have any of my children having pain during any procedure. And generally, if you are not able to stay still, usually children up to the age of 10 are not able to stay still. So for those reasons, I do perform the circumcision under general anesthetic. I use a scalpel to cut the skin, and then something called a diathermy to seal off the blood vessels in between the skin, and then join the skin together with glue. And that's because with the glue there is no track lines from the sutures, and it heals very nicely. And also when the glue is there, it forms a waterproof barrier for when the child passes urine, the urine doesn't get into the wound, which is painful because the urine is salty. So salt water into wound is painful.
Right. And great. And what's the typical recovery time?
So usually within 3 or 4 days, the child is pain-free, but the penis remains swollen and doesn't look very nice for up to 2 weeks. After that, the swelling will come down. I will advise patients or parents to soak their child's penises into salt water after the 4th day following surgery, and do it daily until the swelling and the inflammation comes down.
Understand. Great. Thank you, Doc.
Okay.